Hi everyone, you're welcome back to my channel. My name is Becky Setra. I hope you're doing well. So in today's video, I'm answering a question of one of my subscribers who wanted to know the advantages and disadvantages of becoming a clinical nurse specialist in the UK. If this is the first time you've come across my channel, you're very welcome. Please remember to like, subscribe and share, and see you in the main video. You're welcome back to the main video. So you may want to find out what a clinical nurse specialist is in the UK. So a clinical nurse specialist is a highly trained nurse. I know all nurses are highly trained, but these are nurses who are highly trained to provide an enhanced care to patients in a specific specialty area, and they are very important part of the multidisciplinary team. Example of specialist nurses or clinical nurse specialists are nurses who look after patients, specifically, let's say a cardiology specialist nurse, we have epilepsy nurse specialists, we have MS specialist nurses, we have Parkinson's specialist nurses, we have respiratory specialist nurses, we have a headache specialist nurse, stoma specialist nurse, DVT specialist nurse, and the name or the list goes on. There are several hundreds, if not more, specialist nurses or clinical nurse specialists in the UK. So I will start with the disadvantages first before going to the advantages of becoming a clinical nurse specialist in the UK. So the first disadvantage I would actually want to mention is the fact that you are going to be earning less money. Because I work with some nurses who have transitioned from the bedside to, or which is the ward environment, to becoming specialist nurses, and they've told me when they received their first salary, they just could not believe the dip in their salary. Although they were band 5s, or some are high, let's say the top of band 5, so they were earning okay. They were earning a lot of money because they work night, they work weekends, so they have unsocial hours working incentives, so they make more money than now that they have become band 6 nurses. Although the band 6 annual salary is higher than band 5 annual salary, because as a specialist nurse, you're working Monday to Friday, 9 till 5. You don't have any enhanced pay, so your salary would be very dry. So if you are considering becoming a clinical nurse specialist in the UK, yes, you need to think about that. Your pocket would be quite dry. You get the minimum, but one thing is you would be able to do bank shift if you wish to. Those on agencies, you can do agency shift in addition to that, but it means you're working more, because as a specialist nurse, you're already working. If you're working full-time, you're working Monday to Friday, so you only have your Saturday and Sunday to be doing something extra if you wish to. So financial is one of them. Another disadvantage is loneliness. So you feel lonely sometimes, you feel isolated sometimes. Those who are in the team are okay. If you're working on the ward, you have a bigger team, but if you become a specialist nurse, you'll be working in smaller teams, maybe a team of 3, 4, 5 or 6 nurses. I am a specialist nurse, so I've been a clinical nurse specialist since 2009, and one thing I've realized currently, I've worked in teams before, I was a lead nurse before, but now I work as a lone practitioner, so I'm the only one. So sometimes you can feel very isolated, and you can actually feel very overwhelmed with work, which I will talk about in the future as time goes on in a minute. And it can be very stressful. That is another one, very stressful. Whatever you do today, if you're not able to finish, it stays and waits for you until you come back. Whilst when you're on the ward, you hand over things to the staff that are coming the next day. It's 24/7, but with clinical specialist nurses, because we don't work at weekend, and you don't have you don't have anyone to hand over to sort things out over the weekend or at night. You come back, everything is waiting for you. Yes, it is not an emergency service, but can be stressful. The workload can be overwhelming as well. Although you are a clinical specialist nurse for a specific area, sometimes patients come with other problems, so you need to be very knowledgeable in order to answer their questions. And if you're not able to, then there's a question, or does she even know what she's doing? But apart from that, you should be able to signpost people to where else they can find whatever they want. There are occasions, so those who have their phones as well, for their patients to be able to contact them, it can be overwhelming. Some of the teams I know, they come to work and there is over 20 messages or more, and you have to go through all these messages, answer patients back. Sometimes you call a patient, or they left a message, you call them back, they are not there, and you have to be going and coming forth, calling them again. So that 20 messages that you have can end up becoming 40 or 50, because you're calling people, they are not there, you have to ring them back, and that can be really, really stressful. There are occasions where specialist nurses face some rude patients. I'm very lucky. The group of patients I look after, I haven't really had a rude patient. I know you can meet a rude patient wherever department, even on the wards, but the group of patients we see more are patients who are very frustrated just because they feel other health professionals are not listening to them, so they get to you and they've reached the top. So if you're not careful, they're going to be venting everything on you. But you know what, if you know what to do and how to calm things down, you should be okay. Now let's look at some of the, I think I've got another one. Yes, another disadvantage is loss of some of your bedside nursing skills. The reason being that it doesn't mean you forget everything. I have been out of the ward since 2009, so if I go to the ward to go and work, I'll find myself wanting. I can wash patients, I can provide the basic nursing care to patients, but as you know, every day paperwork is changing, all the equipment that are being used on the ward are changing. These days they're doing a lot more of online, or they use iPad for observations, they use electronic systems for drug administration and all that, and I haven't done that for a long time. So if I go on the ward and I'm asked to go and give medications, yes, I know what to do, I know how much dose and whatever, but all those electronic systems, I have no clue, so I wouldn't be able to do it. So that's another thing. So if you move on to the clinical specialist nursing field, if you're not keeping your practice, ward-related practice and use of all equipment and electronic systems up to date, you may lose out. So that is something to consider. Shall we go to some of the advantages now? So the advantages, the first one is the fact that you work Monday to Friday, so you can plan your weekends, but bear in mind you're not getting much money for that. You can plan your weekend activities, but actually you are limited, because those who work on the ward, sometimes they work 3 long days or 3 nights, they have 4 days free, or the other way around. There are also opportunities for you to develop professionally as part of one of the advantages. So you have professional development opportunities. You would be sent to do some training, you'll be attending conferences, and there are opportunities for those who deal with medication for patients to actually go and do the nurse prescribing course. currently I've started. That's why I've been a bit slow on recording videos. I've started a course, which is one of the courses you need to do first before you do your nurse prescribing. And actually, I don't know what I'm doing because I finished university in 1999. Can you imagine? And I'm having to go back to uni and do all these assignments. Sometimes I come back and I ask myself, what did they just say? Anyway, so those are some of the advantages. So you get opportunities to develop. Another advantage is you become knowledgeable in a specific specialty area. So for example, currently in my role as a headache specialist nurse, yes, I've gained a lot of knowledge about that. I was a specialist nurse or lead nurse for sickle cell and thalassemia in the past, and it's like, I've got all these knowledge that if I meet someone who needs help in those fields, I would be able to advise them appropriately. Another advantage is the fact that you feel appreciated by your patients because they know what you're doing for them. Yes, if you're working on the ward, you have that appreciation. They say thank you to you for doing things for them. But specialist nurses is a bit, because there are times patients come and they give you a card, thank you card, which you can use for your revalidation as well. Whereas on the ward, if they bring a card, it's for the whole ward. But as a clinical nurse specialist, people appreciate and give you a card. I have a way of obtaining feedback from my patients. There's a QR code. They just scan it, and anonymously, they actually say how they feel about the service, and you read it and it puts a smile on your face. So those are some of the things, and you learn to become more empathetic with your patients. All nurses, or majority of nurses, are very empathetic. That's why they're doing their job. But you become a patient advisor, a counselor. Although you haven't got the experience in those things, it comes naturally. There are times where you have patients come to clinic. Recently, I've had a lady come into clinic, and she said when she was waiting outside in the reception area, she felt like crying, but she held it back. As soon as she came into the clinic room, she started shedding tears. So I have to give her the time to shed the tears, give her tissue, and give her that space. And then she was able to tell me what she was going through. And the fact that you're able to just listen to that patient, that alone makes a lot of difference. So empathy comes in as a clinical specialist nurse, and you feel great at the end of it that this person trusts in me and is able to share whatever they are going through, and that has made them feel better before going out. So basically, it could be relationship issues, it could be family issues, some of them financial issues and things like that. So you become jack of all trades as a clinical specialist nurse. And development wise, mostly professional development is available because becoming a clinical nurse specialist, you would start from band 6. There are opportunities for you, if not in your department, to take the transferable skills you have to another department if you decide to apply for a band 7 role. There are some specialist nurses who are band 8As because they become advanced nurse practitioners. Some are team leads as well. There are specialist nurse consultants as well. So there are several opportunities there. I am a band 7. I've been a band 7 for a long time. I don't know if I want to pursue band 8 because in 6-7 years time I might be considering retiring, so I don't know. But oh well. Basically, if you're out there and you're thinking about becoming a clinical nurse specialist in the UK, these are some of the things you should look at and think about your personal circumstances. Somebody would want to do it because they are working Monday to Friday, 9 till 5. Some would prefer to work on the ward. Whatever decision you make is absolutely okay. I would not discourage you from becoming a clinical nurse specialist. Go for it, but bear in mind it is not for everybody. Some people go in and they realize it's too much, I can't deal with it, I'd rather go back to the ward. Some have moved into it and they find it fantastic. If you are a new nurse and you're thinking of becoming a clinical nurse specialist, my personal advice to you would be get a lot of experience on the ward before you do it. But at the same time, some of you are very clever and you have a lot of life experience that you can bring to becoming a clinical nurse specialist. So it's up to you. You can do it. Anyway, take care of yourselves. Remember to like, subscribe and share as well. And I'll see you again soon. I'm very busy these days with my studies, so bear with me. As soon as I finish, you see more of me. Anyway, take care and I'll see you again later. Bye-bye.